Hi, I'm Peter CHURN from the Harbours Medical Practice, and this is a short video about some things that we can try to improve our mental health. I'm filming this here in Binning Wood, which is a place that means a huge amount to me personally. It reminds me of a very special patient who really taught me everything, so this video is for him. And I felt really long and hard about doing this video because conversations about our mental health are some of the most personal and intimate that we have, and I'm desperate that this video doesn't seem like a series of short life hacks, and appreciate just how difficult and challenging life can be, particularly at the moment. It's just a series of things that have helped me personally, that I found have really helped patients. Maybe they'll help you too. Or maybe the most important thing is connection and nurturing wider groups of friends. Humans evolved in tribes of 20 or 30 people, and it's only relatively recently that we've disbanded our bigger tribes and we live in small family units. And I think it just puts so much pressure on the relationships within those units. It can be so difficult when you're feeling low and down to actually find your tribe and reach out, and when you're not really feeling like it, spending time with other people. But I think it's crucially important. I like to think of the old adage, it takes a village to raise an adult. Well, I've run with a huge grin on my face. I've also run feeling so irritated and frustrated and angry, and I've run with a sense of real nauseous sadness, sometimes a sense of really enjoyable melancholy. But I've also run with tears actually running down my face, and I've never not felt better afterwards. So when your emotions are howling like this wind, well, exercise would seem like a pretty good place to start. And just start. Well, there's a growing understanding that what we eat is as important for our mental health as it is for our physical health. It turns out that the majority of serotonin, which is the chemical that's probably most closely linked with our mental well-being and happiness, is actually produced in the gut from the trillions of bacteria that live there, the gut microbiome. So eating a diet that's rich in plant foods, so lots of fruit and vegetables, as wide a variety as possible, and whole food pulses and grains, might actually have a huge influence on our mental health. We don't quite understand how it all works yet, so until we do, I think it's very important to hedge your bets, quite literally. Well, I'm pretty embarrassed to admit that for me, it's become apparent that how much time I spend on my phone can have a really detrimental effect on my mental health. These things are engineered to grab your attention, and the little hits of dopamine that alerts on your apps and checking it gives you can really make you more anxious, they can make you irritable, and for me they certainly make me more distracted, affect my concentration and make me less present in my life. So turning off alerts, putting your phone away and scheduling time to look at it can have a really positive effect on your mental health. I'm trying to be really careful about looking at my phone in front of my kids because of the message that it gives them that my phone is more important than them. And there is some emerging evidence that phone use is affecting the long-term concentration span of our kids. And be particularly careful about what apps you choose to retain. Maybe only those that are the best way of achieving what it is you want to achieve, whether it's getting news or just keeping in touch with people that you wouldn't otherwise see face to face. And try not to follow just the highlights reel of somebody else's life. I think it is guaranteed to make you thoroughly miserable. Well, we hear a lot about resilience at the moment, and I have a feeling that sometimes we're misinterpreting the term. Being resilient doesn't just mean putting up with stuff. Being resilient often means having the courage and the strength to actually do something about it. Sometimes how you feel is entirely appropriate for the situation that you find yourself in. And actually recognizing that, understanding what's making you feel bad and doing something about it, well, I think that's resilience. There's some pretty compelling evidence now for things like cold water swimming in the treatment of anxiety and depression. And we don't really know why, but perhaps there's something about overcoming a challenge and just feeling good about yourself afterwards. I mean, it's really cold. Well, when talking about absinthe, Oscar Wilde said, after the first glass, you see things as you wish they were. After the second, you see things as they are not. And finally, you see things as they really are. And that is the most horrible thing in the world. And it's safe to say that if you're struggling with your mental health, then alcohol is not going to help. But worse than that, you may not even be aware of some of the harm that it is causing. So what about that sense of irritability, frustration towards your partner or kids at the weekend? What about that sense of nausea, anxiety and dread if you're driving to work on a Monday morning? Well, maybe alcohol plays a part there too. And I'm afraid there's really only one way to find out. I suspect you'll feel better. And as G.K. Chesterton said, drink when you're happy, but never because you're miserable. Well, when you're feeling bad, actually one of the best ways to start feeling better is to do something good, to do something nice for somebody else. Kindness is contagious. You feel better, they feel better, and actually they're more likely to do something nice for somebody else. You can have a pyramid scheme of kindness. One of the best ways of doing it is volunteering. I mean, what could be better? Spending time in nature would have to be the exact opposite of stress. Well, having talked about connection, it may seem a bit odd to be thinking about solitude, but I think it's what's missing in a lot of our frantic lives. When we're constantly on with our devices and with work and friends and family, I think we need to work really hard to chisel out a bit of time to sit with our own thoughts. Maybe getting up a bit earlier and just having a cup of tea, or going for a walk by yourself. If you've got a dog, take the dog out. And some of you may feel you get a bit too much solitude, but I think it's important to be comfortable with your thoughts. It's going to look a bit smug, isn't it? Well, we don't all sleep like border terriers. But there's not a mental health condition that has a normal sleep pattern. And it's a bit chicken and egg as to which comes first, but certainly improving your sleep is likely to improve your mental health. So, getting lots of morning sunshine, no caffeine after 10 o'clock in the morning, reducing alcohol, and going to bed and getting up at the same time every single day. Perhaps most importantly, turning off tech and devices and not being on your phone for a good 90 minutes before you go to bed. It's certainly working for Monty. Well, thank you so much for watching. If life is feeling really difficult now, please talk to somebody. Remember that when life is at its most challenging, it's often when we learn most about ourselves and what really matters. Be kind to yourself, be kind to others, and hopefully we'll all be feeling a lot better soon.